Good afternoon. I'm Elizabeth Henry, President of the Environmental League of Massachusetts. For those that don't know us, ELM is a 122-year-old environmental advocacy organization based on Beacon Hill. We have been advocating for Massachusetts to lead the nation in responsible environmental policy since 1898. I'm really delighted to welcome our over 200 registrants joining us by Zoom, and the many of you who are watching this on Facebook Live. You include policymakers, business people, environmental advocates, social justice leaders, parents, grandparents, teachers, and students. And we are so pleased to have so many employees of our ELM Corporate Council member companies joining us. So welcome to the first edition of ELM's Earth Month webinar series called Climate And. In these 4 sessions, we will discuss intersectional climate issues with a diverse array of thought leaders. We'll explore how Massachusetts can fight the climate crisis while building a healthy, green, just, and prosperous future for the people of the Commonwealth. The topics for the following Thursdays in April are climate and clean energy, climate and equity, and climate and economy. But today's webinar will cover climate and health. It is moderated by ELM's newest board member, Dr. Natalia Linos, with panelists Representative Dr. John Santiago, Kevin Bartlett, and Dr. Jonathan Sussman. You can submit questions for the panelists in the Q&A box. And this webinar will be recorded and available on ELM's YouTube channel. This panel is made possible through the generous support of ELM Corporate Council member Takeda. So I'll now turn it over to Debbie Donovan. She's Takeda's Senior Vice President of Corporate Environment, Health, and Safety. Thanks again, Debbie.
Thanks, Elizabeth. Thanks, everybody, for joining. Hopefully, I'm sharing my screen here. Let's see if that works. I just want to give you a little bit about Takeda. Many of you may not know us, but we are a global values-based R&D driven company. When you see the map, this always throws me as a US person that we're brought up with the US being in the center of the map, but we are a Japanese company. We're headquartered in Tokyo. We also have in the greater Boston area, our global hub. We have a big research operation in Central and Kendall Square. And I'll go into just specifically about what we do in Massachusetts, but we do have quite a global footprint. You can see our global remit, how many employees we have, where they sit, and we are in about 80 countries around the world. There we go. In Massachusetts, we've got 20 individual locations, over 450,000 square feet of lab space, and just under 7,000 employees, making us the largest biopharma employer in Massachusetts. We have both a research operations and manufacturing site. We have a manufacturing site in Lexington and one in Cambridge as well. I wanted to touch on, why is it important for us to be part of this climate and health conversation? We view ourselves as a healthcare company, and our purpose as a company is to bring better health to people and brighter future for the world. And with climate being such a connection to health, this was an important effort for us to participate in, because we've made the connection that as a healthcare company, climate change as an existential threat to people's health is an important thing for us to be a leader on. So we want to discover life transforming treatments, but be guided by our purpose to deliver for patients, people, and protect the planet. You see in the middle, we talk about our integrity, fairness, honesty, and perseverance. We call that Takedaism. That's what it's about working here. Those are the values of our company. And we bring that to life through a decision-making framework that we call PTRB, patient, trust, reputation, and business, in that order. So we basically make business decisions based on, is it good for the patient? If the answer is yes, we do it. Does it build trust with society and our stakeholders? The answer is yes, we do it. Does it enhance or build on Takeda's reputation with those stakeholders? And then lastly, if we do the first 3 right, the business will follow. So we will be rewarded in business if we take care of the patient, trust, and reputation. You can see below the imperatives that we have in our new corporate philosophy, where we've integrated sustainability into how we work and the way we work. So it's not viewed as extra work at Takeda. This is the way we do the work. And they're bundled into different buckets. So we have a patient bucket, and that's what we're all about, is bringing science to life-changing, life-altering therapies, medicines and vaccines, and accelerating access to people worldwide. In the people bucket, we talk about creating an exceptional people experience, having a diverse and inclusive environment that's safe and takes care of people's well-being. And then lastly, in planet, which is the subject of today's meeting, is protecting our planet, not just climate. So I know today's discussion is on climate, but also the use of natural resources, water, waste minimization, and incorporating green chemistry and circular economy principles into the development of those medications and services that we bring to our patients. And underpinned by all of that, we have unleashing the power of data and digital to facilitate making all that happen. So I'm excited to have Takeda be the sponsor for this first ELM webinar and celebrating Earth Month, or kicking off Earth Month, and look forward to great conversation. So with that, back to Natalia, who will open up the panel.
Thank you so much, Debbie, and thank you to Takeda. And welcome everyone to this week's panel on climate and health. My name is Natalia Linos. I currently serve as the Executive Director of the FXB Center for Health and Human Rights at Harvard University. And I previously led the UN Development Programme's Climate and Health portfolio, its global portfolio. And I'm so thrilled to be here with Representative Dr. John Santiago, who people know as Massachusetts State Representative for the 9th Suffolk District, who is also an emergency room physician at Boston Medical Center. Dr. Jonathan Slutzman, emergency room physician and medical director of environmental sustainability at Mass General Hospital, and now the director of the brand new MGH Center for the Environment and Health, as well as Kevin Bartlett, the global head of environmental sustainability and risk at Takeda Pharmaceuticals. And before we begin, I do want to acknowledge that two of our doctors here are ER docs who have been at the front lines of the COVID-19 pandemic, to thank you for your service and to call on you to reflect on what this horrible year has meant and what preparedness might look like on the climate front because of what we've learned from this pandemic. And the way we're going to structure this conversation is we're going to start off with one question that each panelist will be asked to elaborate so that you can get to know them. And then we're going to go into a discussion amongst ourselves with follow-up questions before we open it up for questions from the audience. But at any point, feel free to put in your questions using the Q&A function. So with that, let's start. And I should say that I have asked for the permission of the panelists to use their first names. I do that because I want it to be more conversational, to be more comfortable for all of us. And we're going to start with Jonathan. Jonathan, today, you and the MGH team launched the Center for Health and Environment. Can you tell us why? Why now? What are your goals? And since you're our first speaker, can you give us a quick 101 on climate and how it impacts health?
Yeah, thank you, Natalia, and thank you to ELM for hosting us, and to my co-panelists here. I think this is obviously a supremely important topic. We at MGH are amazingly excited to be launching the Center for the Environment and Health today. And the reason is both clear and complex. This is the next step on MGH's environmental sustainability journey, on which we have been traveling for well more than a decade in leadership in environmental matters. And really what we're doing is growing in our hopeful success going forward. Our mission at the center is deceptively simple. It's to bring environmental issues and environmental thinking and infuse them into all aspects of the hospital's mission, from clinical care to research, education, and community health, which we're taking to mean through advocacy for the greater good. And you asked why now? The better question is, if not now, when? This is an immense time to be showing how the health of our natural environment, how our climate are just so inextricably linked to our health and our human health. We know through pretty rigorous research that climate change and environmental pollution impact heart disease, kidney disease, respiratory illness, strokes. We can go on and on in the ways that it impacts people. The numbers are fairly staggering. Just recently, a number of months ago, we saw some data that suggested that over 10 million people a year die due to air pollution alone. That's not even climate change, that's just air pollution. These are staggering numbers that dwarf many diseases that we pour immense resources into for good reason to try and reduce morbidity and mortality and improve the human condition. We also know that tens of thousands at least die annually due to climate change. That number is a lot harder to nail down just due to research techniques and what we already know, but we know it's easily in the tens of thousands a year. We have seen the impacts of climate change and the climate crisis already. I know that John has in his emergency department, I have in my emergency department, and colleagues around the world have. We have climate refugees coming from places that are harder hit, moving to places where they're hoping to seek safety. And with that, they bring their regular medical concerns that are not being addressed adequately, and then become a burden on our healthcare system, and in particular, our emergency departments. We have seen the impact of increased frequency and increased effectiveness of large-scale storms that are almost certainly due to the increased energy in our atmosphere due to climate change. I'm an environmental engineer by training, and I like to rely on that kind of thinking that really the world is an energy-driven system, that to have a giant storm, it takes a lot of power, it takes a lot of energy to whip up a hurricane. And that energy comes in the form of heat from the atmosphere and from ocean waters. The more energy there is, the bigger and more powerful the storm can be. And that's what we're seeing today. We can see that there are more billion-dollar disasters annually than there ever have been. We know that the warmest years on record have been every year after year in the last decade, with I think one or two exceptions. So these are big problems. And even worse, on top of that, for those of us in healthcare trying to do the right thing for our patients, these impacts are affecting our supply chains. How many patients did John and I see just a couple of years ago where we couldn't give IV fluids because the factories were shut down due to hurricanes in the Caribbean, particularly in Puerto Rico? So we were giving out cans of Gatorade in our emergency departments. These are supreme impacts on the way that we provide care and on the quality of the care that we provide.
Thank you so much, Jonathan. Sorry,
yeah.
No, go ahead. Go ahead.
Lastly, I'll just say that we in healthcare, we have the moral imperative compared to any other industry that we actually have to do this. Our job is to take care of people. And so that's why healthcare has to lead in climate and environment.
Thank you so much, Jonathan. And I congratulate you on the center. And you're absolutely right. We need to walk the talk in the healthcare industry. And I'm going to turn to John, Representative Santiago. You're both a physician and a state representative, and we'd like to hear about how your experience as a healthcare professional informs your views on climate policy, and especially if you can speak to the Next Generation Roadmap bill that the governor finally signed into law, and what impact you think that will have for our communities.
Great. Well, thank you so much. It's an honor to be here with each and every one of you. Thank you to ELM for hosting this event. Thank you to Dr. Linos for moderating, and for my co-panelists and my fellow ER doctor on the front lines with me. Congratulations on the opening of your new center. It sounds like an amazing adventure. Looking forward to reaping the benefits of that and the research as we move forward in our quest to make sure that we address these social determinants of health, which is climate is one of them, right? And I think my role as an emergency medicine doctor and state representative, people often look at them as two different hats, but they're really one and the same. The question is, how do we heal people? How do we heal communities? And there's an incredible amount of intersection between the two, because the work I do in the emergency department with each patient I see is really a reflection of what's going on in their respective community and their neighborhood, right? All what we see is essentially the acute manifestation of what's going on, whether it's a lack of educational opportunity, a lack of economic opportunity, access to transportation, housing, and whether we're doing the job we need to be doing when it comes to climate. And I think, all it takes is a place like COVID-19 with Stunta, our society, to give us some sort of awareness. I mean, what COVID-19 has done is essentially taken the lid off all these inequities. It's exposed them and it's exacerbated them. And that's what we're seeing in the emergency department. And, what I take care of in my ER, which, I work at Boston Medical Center, the city safety net hospital, take care of a lot of poor people, vulnerable communities, Black, brown people who, don't just have the best healthcare, institutions to go to, but have been borne the brunt of lack of economic educational opportunities, rates with high, communities with high rates of asthma. And it's important that we realize that this is all, interconnected. I mean, I think, I don't know how long I'll be in politics, but if I can leave politics with the idea of the social determinants of health entering the lexicon, I think, that would be a success of mine. And, when I think about the intersection of health, medicine, and climate, I think about one study that really stuck out to me with respect to the first surge. And it was a study that came out of Harvard, I think the School of Public Health, that looked at 3,000 counties across the country that compared rates of fine particulate air pollution and deaths. And it showed that if you had a small increase in long-term exposure, that resulted in a lot of deaths. And again, that just goes to the intersectionality of all these things. And that's why it's so important, as I enter Beacon Hill each and every day, at least virtually now, that we're fighting for these things. I mean, my goal in becoming a state representative was to bring the stories of my patients to Beacon Hill, not just when it comes to things, of healthcare, whether people have access to insurance or whether pharmaceutical prices are too high, but taking into account the totality of all these experiences. And as you said, the roadmap climate bill was one of those. I mean, we just passed that, I want to say, a couple of weeks ago. As you know, I think I voted on it 4 times because it was vetoed. I think we ran out of time at the end of December. Governor vetoed, so we just passed it again. And I think it's an important bill. It's going to put us on a pathway to a more equitable society with respect to climate. And it really has a couple of main goals that we can highlight. One, it really sets an ambitious statewide goal when it comes to greenhouse emissions, really net zero emissions by 2050 with some incremental goals as we get to 2050. I think it's 50% by 2030. And really just focusing on the sectors that are the hardest hitting when it comes to emissions, particularly the transportation sector. For me, an important one that I care about because I'm from these communities, my personal life, but also my professional life in terms of taking care of those communities are those hardest hit by this. So it codifies environmental justice. It really looks at certain communities defined by race, access to English language, and income, and making sure that they are part of the solution and that they're not going to be steamrolled like they have for decades and generations. I think that I'm particularly excited about is that they try to, in the bill, it allows cities and towns to opt into municipal code to make sure that we're building the greenest and most efficient buildings. And it also makes the utilities, increase the renewable energy portfolio, right? So I think by 2025, if I can recall correctly, they should be having an increase of 3% a year. And this is all a great thing. And I think one thing that I'm most excited about is that the Speaker of the House came out, I want to say last week, and he's been on the forefront of this, talking about how we need to increase, our renewable energy with respect to wind. And so I think we want to double the amount of megawatts that we're going to get. So I think these are all great things. This is a step in the right direction. But as we know, there's much more work to do. And I'm excited to be a part of it, not just in the emergency room, but on Beacon Hill as well.
Thanks so much, John. And Kevin, John mentioned the targets in Massachusetts, and, at the UN, we have targets under the Paris Agreement. We really need the business community to step up if we are to meet those targets, these ambitious targets. And you've worked in corporate sustainability for a wide array of companies and for many, many years. Can you speak to us a little bit about the trends you have seen over time, over different continents, and a little bit about how your healthcare perspective informs what you're hoping to achieve?
Yes, absolutely, Natalia. This is the first time I think I haven't actually tried to talk on mute, but I really do want to thank you for the invite to being part of this panel. I do want to thank my co-panelists and everybody that's in the audience too. I do have a slightly different take on this, and kind of talking about my journey through sustainability, which probably starts on the the usual confidence and wisdom curve. Basically, I thought I knew what sustainability was, and then learned that recently I've got a lot to learn still. So I've been an environmental engineer and EHS professional for a lot of years, but I thought I became a sustainability expert probably many years ago when I was working on a site EHS team, and we were told we needed to start incorporating more environmental sustainability into our EHS program. So we changed the department name to EHSS, and then we felt pretty good about ourselves after that. But we dug in and started doing some really good work, but we were focused really internally. But we stood up a ton of teams. We had green teams, we had energy teams, we had Six Sigma teams, we had waste minimization and reuse and recycling teams. We did some great things. I mean, we had entire facilities that were set up for zero office waste and certified. We switched out refrigerants, we eliminated water leaks, we switched to LED lights, we put in meters, we bought energy efficient appliances, you name it. We really did make a difference, and we were doing some great things. And the challenge was then we were often doing it, fighting for scarce resources and looking for leadership support. And sustainability is really looked at as kind of the nice thing to do once we had all the mission critical things done. But fast forward several years, and I've learned that resource conservation and waste reduction are important, but they're really only part of the sustainability program. Companies really need to think well beyond their own walls. They need to understand, or at least try to understand, the entire environmental and social footprint of their products and services through the life cycles. And that's from cradle to grave, or preferably from cradle to cradle. But for example, if we focused only on our internal operations and try to reduce carbon, we would probably miss 80 to 90% of our company's carbon footprint that's out there. And for water stewardship, if we're looking only at ways that we can reduce water and have some savings there, we missed some of the real issues in the watersheds where we operate. Where do we have stressed water resources? What are those stressors, and how do we best address them? Maybe water conservation isn't the most important thing. One of the more important things that's getting more important today is understanding the expectations of stakeholders, and there are a lot of them. For Takeda, it's upstream suppliers and downstream distributors and customers. I mean, that's the hospitals and doctors, but it's also our employees, it's the investors, it's the communities in which we operate, and most importantly, it's the patients. More and more, these key stakeholders expect us to be environmentally and socially responsible, ethical, engaged in the community, and transparent. And it's because of these stakeholder pressures that these topics are now being discussed in the boardroom. It's not just in the EHSS office. So, and I think it's already been touched on by Jonathan that the main difference between healthcare sectors and others is that through our patients, we see directly how human health is affected by environmental health. It's clear, degrading air quality, increasing scarcity of clean water and other natural resources, and the impacts of climate change are threatening human health, and especially in those vulnerable populations we talked about. So Takeda's been around about 240 years at this point. We've been investing in environmental stewardship for more than 50 years. The company stood up an Environmental Protection Committee in 1970, back before sustainability was cool, I guess. But we understand, as a responsible corporate citizen committed to putting the patients first, and addressing the concerns of our stakeholders, we need to be continually reducing our environmental footprint and fulfill Takeda's purpose. As Debbie mentioned, it's better health for people and brighter future for the world.
Thanks, Kevin. And I think one stakeholder that we don't have represented on this panel is youth. I mean, the youth movement has been so tremendously influential in pushing all of us, I think. But we're talking about, we have some leaders here in the health sector and in politics and business. I want to ask Jonathan this question. I know that the economy comes up, costs. We have seen that come up with COVID, people saying that, cost versus public health. And I have heard that argument in the climate agenda, like, is it too costly? How do we adequately capture the cost of inaction on climate change? And what work have you done there? And Kevin, you can speak to that too. And of course, John, jump in.
This is right there, the big question. And I think that there's a lot of messaging to be done, at least in the sustainability science literature, when it comes to looking at life cycle environmental impacts and life cycle costs of various options within medical care. Every study that I've read that has included life cycle costing has shown that the environmentally better choice is also the less expensive choice when you compare on an appropriate scale, comparing apples to apples. There are also pretty good data. Kevin, you just led into this and mentioned the business case. In management literature, there are at least a handful of studies that have shown that companies that have stronger and more developed environmental practices do better financially in the marketplace, in sales, in growth for investors. They just do better from a purely business perspective. So the way that you asked the question, Natalia, is I think exactly right. It's what is the cost of not doing these things? What is the cost of inaction? And I think there are those studies that have been done. And then there's also just the reality that from an economic perspective, a social economic perspective, the externalities are huge. And at some point, hopefully in the near future, we're going to be putting a price tag on these negative externalities. And that's going to completely change the calculus of what becomes financially viable versus not. As soon as we're paying $100 a ton, $150 a ton, $200 a ton on carbon dioxide emissions, you're going to see certain technologies become much more commonly implemented just because they're better from a cost perspective.
And if I could weigh in as well, I mean, there's a lot of factors in cost, and I absolutely agree with you, John, that if sustainability is worked into the way we do business, I think it's much less disruptive, and it drives a better understanding of the business, understanding where you have hotspots, understanding where you impact the environment and where you should really be focusing your energy. Otherwise, you're just casting a broad net and hoping you're hitting those high nails. So I think in some industries, we're still at some of those learning stages and really trying to understand those life cycle impacts, really understand what it means to have a carbon footprint for creating a medication. Obviously, if we didn't create a medication, we'd have no carbon footprint associated with that manufacturing process. But there's also that carbon footprint associated with doing nothing. What's the cost of patient care in a carbon footprint perspective? I don't think anybody really understands a lot of these things in order to be able to compare apples and apples. So that is one of the things that we're really trying to focus on, to try to understand our own business so we can make changes and make best choices where it counts. The other piece of that as well is technology. And we're limited a little bit with technology as far as how we can get to carbon neutrality, how we can make some of those good decisions. A lot of renewable energy sources out there are not very efficient right now. And there's hope that, especially with hydrogen fuel cells and maybe solar panels and wind power, these things get more and more efficient over time, and they become much more viable sources out there. So the challenge is, what decisions do we make now? Do we change out all our boilers to and electrify all of them? Or do we wait a few years and hopefully we've got fuel cell technology that can maybe come in and get to a place where it's zero emissions, but also have other benefits to it. So trying to decide what to focus on, when to focus on it, and then what are the best choices is sometimes a challenge right now.
Yeah. I'm going to switch us topics just because we're so lucky to have 2 ER doctors, and COVID is on the minds of so many people. John, we know the literature that COVID has hit communities of color much harder. Are there analogies? Are there lessons? How do you view our push on the climate front? Like what can we bring from the COVID kind of, learnings? We're not out of it yet, so I don't want to be
Sure.
Presenting that we are, but I'd love to hear your thoughts.
Well, I mean, you're absolutely right. I mean, when catastrophe happens, whether it's a pandemic, whether it's healthcare related, whether it's economic recession, or in this case, whether we're talking about a climate emergency, those communities most vulnerable will bear the brunt of this, right? We see this in COVID-19. And for those of us who weren't paying attention, now we're well aware. I mean, the fact is, if you are poor, if you're Black or brown, you're 3 to 4 times more likely to be infected, significantly more likely to die. And, that has been my practice on the front lines. And again, working in a safety net hospital, I mean, when you read something in the paper or in the literature that says these folks are at higher risk of infection, intubation, death, and then you're seeing them come to your hospital and caring for them, it really makes a very clear impression on you that more must be done. And I think, my role in the legislature with respect to how we address that equity is really to fight for them in a very bold way and to make sure that they're at the table. And I think about countless examples, the fact that we're a year into this and we're still having this issue. It's not a surprise to anyone, but whether early on, when the governor puts out his crisis standards of care, the idea that if, we get to a place where the demand for ventilators was so high such that, certain communities want to get access to this. How do we allocate services? And a lot of us stood up and said, listen, let's do this in a very equitable way. And let's think about this. I think it's the same thing with respect to climate. I think about the vaccine issue right now. We've been really pushing the governor and the legislature to move in a more equitable manner. And although the vaccine rollout has improved considerably, there still is a significant vaccine equity issue. And the lesson that I've learned is not just push us at the macro level with respect to our role in Beacon Hill, really at the local level, partnering with institutions and people who want to get things done. And just today, as a matter of fact, we were partnering with the local community health center, a logistics organization, some doctors groups, really to vaccinate some of our most vulnerable communities. And that's what we did over the past 2 weeks. I mean, these are people that were Black, brown, poor, disabled, living in Boston Housing Authority buildings that no way in hell they would have been vaccinated. They haven't left their building like in a year, they leave at 6 a.m. And so we thought, let's be innovative, let's target resources to them, and let's do this in a very aggressive manner, because we know that those people were the hardest hit. And I think, we can take those same lessons and use them when it comes to COVID-19. I think about at the grand scale, the fact that we're on pace to hit 200 million people vaccinated in Biden's first 100 days. I mean, we can be big and we can be bold if we have an agenda and a desire to do that. And I think that's why it's so important the work that ELM does and the folks on this phone call who understand these issues and are at the forefront of these policies. Because I do believe that we can fight for a more just and more equitable society, but only if we do it together, and only if we bring these issues to the forefront.
I like that idea of big and bold. And, the climate crisis, like the COVID pandemic, is global. And I think the cooperation that we've seen across countries, across scientists working together for the vaccine is maybe a model. And Jonathan, I don't know, can you speak to that global action, and Kevin too, because the, Takeda is global. How do we go from local action that, Representative Santiago spoke about? We really need the community level work to the global scale. And how do we do that in an integrated fashion, that we're all moving in the right direction on climate and health?
Well, I think the global perspective is important for many of the things we're facing. When it comes to the climate crisis, really, it is a global crisis. A gram of carbon emitted in Boston is the same as a gram of carbon emitted in Mumbai, is the same as a gram of carbon emitted in Moscow. It doesn't matter. Some other environmental pollutants, it does matter. And we see that particularly with respect to our health equity and environmental equity questions. So I think that our solutions have to be global in the sense that Kevin hit on it, that at least for Takeda, it sounds like 80 or 90% of their footprint is related to upstream and downstream issues. In healthcare, it's somewhere in the 60 to 70% range are our generally kind of supply chain impacts, and those supply chains are global. We cannot solve this problem at MGH. We can study it and we can work on it, but we have to work with our suppliers around the world and our partner healthcare institutions around the world. An example would be the UK National Health Service is embarking on the boldest change in climate action among health systems around the world to be net zero the soonest in all scopes, everything. And the effort that they put into their plan clearly trickles down to other health systems that are smaller and don't necessarily have the resources to do those kinds of studies on their own. So clearly this has to be a collaborative effort. And that's one of the reasons we have the center now at MGH, is to really bring together physicians, nurses, PAs, pharmacists, managers, administrators, researchers, supply chain experts, and so on, to sit together to really tackle all of these aspects in one way.
Yeah, and I can add a little bit to that. I think what we can do as leaders is also talk about it. I mean, I think it's made a huge difference for Takeda in the fact that our CEO goes to the World Economic Forum and talks with other CEOs and talks publicly about these things. it drives it drives change. It makes it important. And as I said, they're talking about these things in the boardroom now, which is not the way it was probably even 10 years ago. So that's a big way that we can do that. We can also work together in consortiums. So I know there's probably some folks here that are part of the Pharmaceutical Environmental Group, Pharma Supply Chain Initiative, the European Federation of Pharmaceutical Industries and Associations. And we participate in all of these groups to help, get a little bit larger influence over, whether it's regulatory changes, but it's also in trying to drive change in the industry. And Jonathan also pointed out that, 80 to 90% of our carbon emissions are scope 3. We've been carbon neutral since last year, since 2020 for our fiscal year 19 emissions. And it's a huge expense. We're doing it now through carbon offset purchases. Eventually, we want to get to the point where we're carbon zero without having to rely on those offsets. But the only way we're going to get there is to engage our suppliers. And we're doing that. We're engaging our tier 1 suppliers first and looking at those that represent the highest carbon footprint and working with them to educate them and get them to adopt initiatives to reduce their carbon emissions as well. So we've committed to targets for carbon reduction with our supply chain too. And I think that is a multiplier. So as we do it to them, they're going to have to do it to their supply chain as well, and on and on. So it's the only way we're going to address it. We can't do it by ourselves.
Thanks so much. I'm going to switch to audience questions. We've received quite a few and we only have 10 minutes left. One question is on clean transportation. Transportation is the largest source of emissions in Massachusetts and has such direct impacts on human health, particularly in environmental justice communities. How do we get our leaders to see clean transportation investments as a vital health and justice investment? And John, I'll direct that to you and link it to another question around public policy and what are our biggest policy opportunities. So answer the transportation and tell us if there's another sector that you think is critical.
Well, I agree with you. And that, funny, I was going to just mention that comment right before we switch to the audience questions. I mean, we talked about big and bold when it comes to climate policy, but we have to really understand the intersectionality of all these things and think cross sectors. And I think, as was stated in the question, I mean, the transportation sector plays a huge role in this. And I've been a long advocate for this. I live in the city. In fact, I don't own a car. I ride my bike to work. I take the bus 43 to Beacon Hill, and I take the Orange Line. And making sure that we are investing in transportation infrastructure has been a priority of mine from day one. Right? We cannot rely on cars. Right? And the last vote we actually took in the House of Representatives before COVID happened was actually a $600 million transportation bill that included, a gas tax and some corporate excise tax. And that's something that I feel very strongly about. And the fact that we as a government, particularly from the executive office, are moving in the opposite direction with, taking funds from MBTA, saying people are not, this is when we need to be doubling down on our need for really, a reliant, a safe and affordable transportation infrastructure. And again, tackling this at the state level, not the local level. And so we've been very active on this on the ground here, to the fact that they wanted to cut my bus 43. And we galvanized the community. We said, we can't let this happen because, again, we want people taking public transportation. We want people going. I mean, I wrote an op-ed in the Globe about this, and I made a parallel between health and transportation. The fact that, the woman that cleans the COVID-19 rooms in the hospital that allows me to do my job, an essential worker, can no longer get to work, right? Which will no longer allow me to safely care for my patients in the COVID-19 rooms. And so it's important that we understand the intersectionality of all that, and that we invest in it appropriately. And the second part of that question was,
if there are any other public policy,
the development sector, 110%. I mean, I think we passed a provision in this piece of legislation that would allow cities and towns to opt in, for more energy efficient buildings. That one, also to highlight the education sector. I mean, this could be a renaissance of something that could drive our economic future here, right? If we invest in this, and not just in terms of projects, but in terms of education. The fact that we should be educating these K through 12 vocational schools. I mean, this is going to be an industry that's really going to drive and hopefully clean our our city, our state, and our country. And investing in education. I just went to go talk to some unions about vocational programming, and this issue came up. I mean, what are the jobs of the future going to look like? and what industry are they going to come from? And I think this is something we need to invest in.
Thanks so much, Jonathan. I'm going to turn to you with two questions around a uniqueness of a healthcare approach. So somebody asked, there are a lot of ways to cut carbon emissions. How can healthcare approach that challenge in a different way that centers community health, resilience, and equity? And I'm going to pair it, for the interest of time, with a question around how can the negative health impacts of fossil fuel extraction and infrastructure be better incorporated into the narrative or arguments towards renewable energy? So can you try and take those two?
I'll do the best I can, and I'll preface by saying I'm still an engineer, which means that I am not the communications guy. So what I can say is that Kevin touched on the life cycle thinking and the way to study these problems really being cradle to grave or cradle to cradle if we can develop a truly circular economy and things. And that's the way to incorporate those kinds of upstream impacts, particularly what are the emissions and environmental impacts of extracting fossil fuels, the same as what are the impacts in manufacturing and transporting plastics all over the world, particularly the single-use plastics that we use ubiquitously in healthcare, and that probably are not the greatest choice. And I think that using that kind of approach where you're looking at problems holistically and can describe in language that anybody can understand why it is that you're looking at different sectors and what factors are really the hotspots in designing and building different products or processes. That's, I think, the way to address them. It's to show that so many of these upstream factors are hugely are impactful in how healthcare is going to act. Referring back to the UK NHS plan to go net zero, a big chunk of their reduction is predicated on the United Kingdom changing their electricity grid and going to renewable sources of electricity. That's external to the health system, but it's so integral to what we do. And it's why we really need to support renewable resources with the value that they really provide. So I don't know if that exactly answers the question, but that's kind of the thinking that I bring to it.
Thank you so much. Kevin, do you want to add anything about, is there something unique about Takeda being a pharmaceutical company that you could lead other companies or a different strategy, or would you take the same strategy as other businesses when you're thinking about your approach to, I guess, greening your supply chain and the rest?
Yeah, I mean, we would suffer the same way as any other company out there. I mean, there are some unique differences in healthcare, and really a lot of it is that visibility and focus on the patient. But I mean, Jonathan pointed out, perfectly that one of the big challenges that we face as far as trying to maintain carbon neutrality now and trying to drive towards that carbon zero is a lack of renewable energy sources throughout the globe. I mean, it's a little challenging in parts of the US. We're in the process trying to put together a virtual power purchase agreement that would cause the construction of either a large solar or a large wind farm, probably in the ERCOT area of Texas. And there's other opportunities in the US that's more developed, and the EU is the same thing. But there's other areas where we have businesses, either in South America or Japan or China, that may not have access to those renewable energy sources, which makes it a real challenge. So we need to work with those governments to try to drive and build those renewable energy capabilities in those areas.
Thanks. And we're coming to time, and I'll just add, because I am more of the narrative person, Jonathan, is that, I do think that we're in a unique moment where public health folks, doctors, are really, on the news and in our conversations much more than ever before because of COVID. So we have this opportunity to continue using our voices. We are being interviewed, we're talking about it, the injustice that we're seeing in COVID and linking that to climate and not losing that momentum. Like, let's not become apolitical again. Let's stay and recognize that doctors and clinicians and nurses have a voice on public policy. And so I urge any of the participants listening in who come from those sectors to start speaking out around climate. I think the Lancet said it is the biggest challenge of the 21st century, the biggest public health challenge. And with that, I will close us today. Thank you all for being here, especially the panelists, but also the participants. And as a reminder, this recording will be available on the ELM's YouTube page, so please share it with your network. And don't forget to register for next Thursday's session, which will explore climate and clean energy. And thank you everyone for joining us today, and stay safe.
Thank you all. Thanks, Natalia.